One of my first rotations in internal medicine, and I was in the clinic setting probably for the first time. And for me, Candice really was one of my biggest teachers. And I think that when we're in med school, we're learning a lot about diagnoses from textbooks and learning all these clinical words and thinking we're actually understanding what a disease is like and what it looks like. And then I met Candice and I was like, these textbooks are clearly not enough. Because I didn't know the right questions to ask. Came in, turned the lights on. How are you doing today? Just kind of began all my questions. And I remember just feeling like Candice was really not responding to me, or I just wasn't getting the answers I thought I would get, honestly. And taking a step back in that moment when I realized, okay, hold on, maybe something else is going on here. And this routine that I think I have down is actually not how it should go.
First thing I said, I was like, when you go into other patients' rooms, I was like, ask, can you cut the light on? Because she didn't know, but the light was causing me to have a headache. So it's already early in the morning and you're flipping on lights. So that's going to irritate the patient, especially if we haven't gotten sleep. As I said, don't take it personal. I said a lot of times it's not that patients don't want to answer your questions. It's just we're not in the right headspace to answer them, or, we can't even think of an answer or function because we're still in pain. I said, so, just bear with us and give us some time. And I think that made a difference on how the rest of our week went.
Mm-hmm. Something that I didn't realize when I met you was just that you're kind of living with this pain on a daily basis. Do you feel like that's pretty accurate?
I remember that being a conversation because I think it had been written on my little board in the room, get pain back down to 0. Mm-hmm. And I was like, I am not on the hematology floor, because a hematologist knows we're never at 0. Mm-hmm. For me personally, I live at a 5. So I think once I told you that, you was like, wait, what? Like, you're just always hurting?
One of the things she told me that really moved me and made me rethink how I went about just pain management is, you said, if I was constantly crying, screaming, I wouldn't be able to live my life. I'm always living at this baseline level of pain, and that's a big deal with sickle cell crisis in general. I think when we're in medical school and as clinicians, we're trained to try to judge what's going on if somebody is in a lot of pain, and sometimes we're wrong. Sometimes what's going on the outside isn't accurate.
It's not textbook. And I remember telling her, if you take nothing else from our conversation or this week, it's not going to be textbook. We are patients, and it's case by case. We are not page 17 in a textbook. Mm-hmm. That's not going to work for every patient.
Mm-hmm. We have all this training and knowledge from textbooks, but it's not going to necessarily translate into the clinical world if you're not taking the time to, again, rethink about those biases and talk to your patients and get to know what's going on with them. They tell you in medical school, your patients will be your biggest teachers. And I remember after being done with that week, just feeling like that was very much the case. And
she was very thorough. And I was like, you're going to be amazing when you're not a student. Like, you're going to be amazing, because she was so thorough and wanted to know everything. And I thought that was amazing.
The first time you go into, or you're in that clinical space, you might be excited to just go ahead, do the physical exam, ask all your questions. But you really need to go in and remember that you're meeting this patient at a probably really difficult time if they're here and they're admitted to the hospital, and you don't know everything that's gone that night. Even if you've looked through the charts, even if you've read everything. I mean, almost every day I came in and would learn something that I did not read in the chart.
My last day, we had kind of set up my pain management plan that I was going to be discharged the next day. Late that evening, I kind of knock on the door, and I'm like, come in. And it's her, which I had always seen her in the mornings. And she was like, I heard you might be going home tomorrow and I'm not going to be here. So she made time to come up to my floor and hug me and say goodbye and say, like, thanks for everything. And I thought it was so huge that you found time in the day to do that. So that was like, and I remember my mom was in the room.
Yeah, I got to meet your mom.
And I was like, this is who I was telling you about. She's been so amazing, and she's going to go far, and she's going to be a great doc. Like, she's going to do great things. And that really stuck with me. I think her compassion was one of the biggest things that stuck with me for sure. Don't cry, because I'm a crybaby.